Good afternoon. We have just concluded a set of exams that we administered to our students that for the past 2 months have been rotating at the UTH Children's Hospital. They were in the Department of Pediatrics, honing their pediatric skills. So OSCE means objective, structured, clinical exams. So today we had a variety number of questions, stations we call them, that ranged from looking at the clinical aspects, okay? The clinical process, history taking exam, investigations, managing, prognosticating a patient's condition. That is very important because that is a very blueprint that doctors have to use every time they're evaluating a patient. So we think that students need to make sure that that part of their learning is very structured. So that was one. We also had questions that were interrogating the level of the level of communication skills that these students have actually attained, because all the work that we do, we have to do a lot of communicating. And so it's important that as we grow in our field, we are honing our communication skills. We also had scenarios that looked to see how good these students are in decision making on the spot. Uh, really, because in the clinical setting, this is what you get. Patients will come in very sick, an emergency suddenly, and you have to react, or else you lose your precious moments. Very critically ill patients, very disturbing, even mentally, very disturbing scenarios. So students are honed into that, and it's not very easy. And the beginning is really quite fraught with a lot of mistakes. But the more they practice it and the more they do it, you actually find that they get better at it. And so that once now they are thrown into a real scenario, they're actually able to handle it. Yeah. So we had a good day, and we had a lot of students that did quite well. Some of them now are going on to another rotation, and others are going on to their final exams. We wish you well. Thank you.